Hello, my name is Stephanie Beasley. I'm the Division Director for Children and Family Services for the Nebraska Department of Health and Human Services. And I'm here to open up with the celebration of the Child Welfare Workforce Development Month. September is a month for us to celebrate the incredible work being done across Nebraska and our nation on behalf of vulnerable children and families who need our supports. Here in a second, you're going to hear from two of our team who have built a career doing just that. They make a tremendous impact every day on behalf of children and families with a long-term lens for well-being across Nebraska. So I'm excited to celebrate them, and I appreciate their time. I'm excited to celebrate each of you. I think the work that you do is phenomenal. I've built my career and spent my career since I graduated from college in the field of child welfare and in work with vulnerable persons. I think I have been blessed for many years with a wonderful career and the opportunity to really work with some incredible people, both as teammates and then the people that I was here to try to support. So thank you for all the work that you do. Thank you for the two professionals who are getting ready to share their experience and their story and their why behind this work. I am blessed, as I said before, to be able to be in this field working alongside each one of you, and very grateful for all that you do for children and families across Nebraska. Thank you.
My name is Beth Boer, and I am an administrator with Children and Family Services here. I joined the department in 2012.
My name is Keisha Adams Parks. I'm an income maintenance foster care supervisor with Children and Family Services. I've been with DHHS since 1996, but I've been in this capacity since September of 2011.
In my role, I help staff who work frontline with families who have intakes or cases accepted to reach out and help when child abuse or neglect is happening or significant mental health needs are occurring. I work with the frontline staff to help them through that.
Well, I supervise a unit for Southeast Service Area, and we pretty much determine 4E funding, federal funding for state wards, and we also monitor converted adoption and guardianship cases until the age of 19.
Working in child abuse and neglect is very stressful and can weigh on you heavily due to the families you work with wanting them to be so successful. Some advice I give to staff and also myself is to remember why you got into this line of work in the first place. Keep that kind of always in your forefront. And also know that sometimes when we're touching families' lives, it's the hardest point in their life. And thinking about my own difficulties throughout my life, having someone partnering with me and giving me opportunities for hope is kind of like the best attitude to have when approaching the families we're helping.
I think the biggest thing is realizing that we work with a very vulnerable population, with the families in and of itself, but with children. And so it can hit home some of the things that we see, but all in all, just knowing that you are affecting lives even though you may not see it directly, you do have an influence on it.
Food days are always my favorite. Outside of that, I would say one where either a family we're working with and they've had a lot of barriers to success start to have things turn around, or a worker who's been really stressed about partnering with a family finds a way to connect with them and feels like they're turning a corner really to change the trajectory of their lives.
A good day of work would be, for me and my unit, we work with a lot of different units. We work with families and we work with CFS workers. So a good day will consist of, solving some fires, emergency situations with our families. They can't get the services that they need, or CFS workers and helping them to be able to ensure safety for some of their kids. And then also making sure that we are maximizing our Nebraska state tax dollars by being able to obtain more federal funding.
My future here at HHS, my career goals. That's hard because I really love what I do. I love coaching staff. I love partnering with staff. I love seeing the work that we're doing with our community partners and families. I love everything about that. But I also love training and teaching and onboarding new developments in our line of work. And so I'm hoping at some point I will get the opportunity to kind of grow in that capacity to provide some programming for our frontline staff to help them do their job easier.
Well, I like the close to the groundwork, the front lines, but then I also like being able to formulate efficiencies and processes to make things better for our families, but then also co-workers and just policies and things like that. So just making sure things are efficient and kind of roll with the times. So I kind of see something along those areas.